Becky Williams, thank you. Becky, as you know, SEIU members know this, the first citizen, the first member president of SEIU, first member president. And I want, guy right here, I want you in my team, man, my next election. You are so good. He's the one that made, he's always the one that stands up first. So. But what Becky and what SEIU have done on organizing, Harriet Applegate mentioned how important organizing is, how important the Employee Free Choice Act is, and SEIU has led the way and made such a difference in organizing, particularly low-paid workers. I remember, I was in Cincinnati at an AFL-CIO dinner about a year and a half ago, and they had the janitors, there was a table of janitors that had just signed their first contract with SEIU. They were SEIU, they'd signed their first contract with downtown business owners in Cincinnati, and they were going to get their first week of vacation in their entire lives. They were going to have health care, they were going to have a pension, small one but growing, and it was all because they joined a union and that union fought for them. Robin, thank you for what you do thank you for all you're doing for your mother and for all of us. We so appreciate that. Pastor Lentz, thank you. Sonia, thank you for your courage for standing back up. We wouldn't let her stand. We made her sit. She wanted to stand and we wouldn't let her. And Pastor Lentz, thank you for opening up your church to us and for the work for social and economic justice that you do. And my new friend Marjorie with Acorn, and I told her, I'm just tired of people beating up Acorn. Every politician in Washington, every right-winger wants to beat up Acorn. And Marjorie and Sophie, thanks for what you did. Karen with Jobs for Justice, and Pam, I didn't think you were nervous at all when you were speaking. So I don't care what they said. So, and Sharon, thank you for what you do for the labor movement. In Sybil, I enjoyed my time in Youngstown. The organizing group in Youngstown is just incredible, and you ought to find out more what the it's called the Mahoning Valley Organizing Collaborative. You ought to find out what they're doing, because they're making sure that every person that's eligible in the Mahoning Valley is signing up for earned income tax credit, is going to get S-chip, is going to get any kind of benefit that they have earned, particularly the working poor that they fought for in the Mahoning Valley. And all of us all over the state ought to learn from what they're doing. I grew up frankly luckier than most people. I grew up the son with one of three boys with two loving parents. My father is a family doctor who made house calls, who served with even people that couldn't, regardless of ability to pay, and he taught me about what healthcare should be all about, and taught me about what economic justice is all about. I grew up the son of a mother who was just absolutely incredible. Many in this room knew my mother. My mother really taught. My mother was very involved in the YWCAs around the state. The YWs probably fought for economic and social and fought for women's rights and civil rights perhaps more than any group in this country over the last many decades. My mother, as many of you know, died in early February at the age of 88. She, right up until the end in November, she ran the local senior citizens levy campaign and passed it, of course, because it was my mother doing it. And she got sick in mid-December. We were with her the last month of her life, or the last 6 weeks of her life. She was home, and I just wanted to briefly say how much, what incredible people that do hospice home care are. And so many of you, have taken care of a dying son or daughter or mother or father or husband or wife or sister or brother, and know what that means, and the empathy they summon up for people they don't even, if they've never met before, is just astounding. My mother was alert and talkative until the last 48 hours or so of her life, and about a week before she died, my wife Connie, maybe if you know Connie, and my brothers and I were all around, and my mom said to me, she said, "Would you sing a hymn to me?" And we grew up in the Lutheran church, so I went in the other room and I got our red Lutheran hymnal, and I sang a song. Pastor Lentz, you may know that this is not a Presbyterian song, but nonetheless, it's a song. It was a song called "Beautiful Savior." I won't sing it to you, but it was "Beautiful Savior." And I stood by my mom's bed and sang her, I think, 3 verses of it. And she said, she kind of lay back as she was lying there, and she smiled. She said, "That was really nice, Sherrod." And she said, "But you know, you really sound better in a group." So I got that. Tell me we all didn't have parents like that never miss a chance. thank you. First, just thank you for being here, most importantly. But, well, more importantly than that, thank you for your activism. Thank you for your fight, the fight you all have in you for social, especially you over there, for social and for social and hold it. But, you know, I look at what you've done in 06 and 08, in what you've done, not just at election time, what you've done between elections. It's so important. But prior to 2006, not that long ago, you remember in those days, the drug companies wrote the Medicare law, the health insurance companies wrote the health care law. Well, those days are over. In 2006, you said, you in Ohio and all of us around the country said, no more the conservative era with tax cuts for the rich, unending war that our grandchildren pay for, the drug companies writing the Medicare laws, the big companies that outsource jobs write the trade laws. We said that era is over. Then in 2008, with the election of President Obama and the election of others around the country, what we did was all of us together, launched a new progressive era in this country. That's why this is our opportunity now to do national health care reform. And look what that means. Just briefly, in the last 75 years history of our country, in the early 1930s, there was the first big progressive era of the last many decades with the election of Franklin Roosevelt. And look what happened. We got Social Security, we got minimum wage, we got collective bargaining, we got the Civilian Conservation Corps and the Work Progress Administration and the FDIC and the SEC and all the things that really protected consumers and investors and all of us for many, many years into the future. That was the first progressive era. Think what happened in the 1960s with LBJ with JFK and LBJ and a new Congress, when we got civil rights and voting rights in the Office of Economic Opportunities, and Head Start, and Medicare, and Medicaid. Think of that progressive era, what we did. And the elections of 2006 and 2008 are launching this new progressive era, an era where we're going to see the government for a change on the side of the middle class, a government on the change on the side of the least less privileged, a government that's going to fight for working people, that's going to see more people join unions, it's going to fight for better environmental and food safety laws and protections for children and women and all of the things that everybody in this room and all our values speak to. That's what we're going to see with this new progressive era. Now, so several years ago, there was a study done of the United States healthcare system, comparing us with healthcare systems around the world. They took several different indices of measuring healthcare performance, and they rated the U.S. and rated the 13 richest industrial democracies in the world. Life expectancy, infant mortality, maternal mortality, immunization rates, all kinds of things like that. In the United States, of the 13 richest countries in the world, we came in 12th of the 13 in healthcare indices, even though we spend twice as much as anybody else. But I tell you that not to depress us, but I tell you that because there was one category where the United States finished near the top. And that category was life expectancy at 65. So in other words, if you get to be 65 in this country, if you live to 65, you're likely going to have a longer, healthier, more productive life than people almost anywhere else in the world. Why is that? Medicare. That's exactly right. And that's why the public option in this health care bill is so important. We're going to regulate insurance companies way better than we've done. No more community rating, no more keeping people out, no more pre-existing condition, all of those things that the insurance companies use to game the system.